Mozambique is an African country located on the southeastern coast. Zimbabwe, Tanzania, Malawi, South Africa, Swaziland, and the Indian Ocean border the country. In 1752, Mozambique was conquered and colonized by the Portuguese. It wasn't until 1975 when the nation was able to gain independence, allowing them to thrive independently as their own nation. Yet although Mozambique is no longer under Portuguese rule, the legacies the Portuguese left on Mozambique remain. Today, a lack of education has left literacy rates at an all-time low, with more females to males illiterate. Poverty has also caused a malnourished society, and the calorie per intake per day is one of the lowest in the world. Access to proper health care remains a struggle, and the prominence of disease is great. 22.7 million people living within the underdeveloped world within Mozambique continue to struggle. Our group developed a course of action to help foster beneficial change.
The population of Mozambique is increasing rapidly. In 2012, each woman was having around 5.26 children on average. This high fertility rate has increased their population to 27.22 million people. With an expanding population comes a rising need for proper infrastructure and sanitation. This and a higher number of HIV cases in the country together have caused their life expectancy to be roughly 55 years. The life expectancy trend is tending to increase over time due to foreign aid and technological advancements. Unfortunately, Mozambique is struggling economically. With a GDP at market price of roughly $16 billion, they are ranked as one of the lower income countries in the world. This low GDP is shown in the average monthly minimum wage of the people. They are making around $95 every month, which estimates to about $3 a day. Sadly, this means every person in Mozambique is only making around $1,100 a year. Without our help, the people will never rise out of poverty. We have estimated the total cost of aid that we would like to implement for the people of Mozambique to be approximately $13 million. In order for the quality of life to improve, we need to focus mostly on improving healthcare, education, and lastly, infrastructure. We have allocated the funds according to the needs of the people, with $6 million going toward healthcare, $4.5 million to education, and $2.5 million to improve infrastructure.
In accordance with the World Health Organization's strategic agenda in Mozambique, we propose $6 million be allocated to ultimately strengthen and increase the people's access to healthcare, reduce the disease burden, improve maternal and child health, and finally improve leadership, governance, and partnership.
But we as NGOs also, we need funding from outside so we can help the government build health centers, health equipment. They need help. Like in Tsangano, they've got only a pickup. They don't have the ambulance here. There's only ambulance from Angone. There's a lack of equipment, hospital equipment. Yeah. Also, staff. There's a lack of staff, especially at the mother and child. In maternity, it's a big problem. Tsangano has got only one nurse who assists in maternity. Just imagine, this is big and people have to come. So they need support. The government.
However, we realize that with an allocated $6 million, not all of these problems can be solved at once. Therefore, we have chosen to focus on improving three main issues by implementing mobile HIV/AIDS treatment clinics across the country. In doing so, we hope to specifically first increase treatment and prevention, and secondly, increase the amount of medical professionals and training throughout the country. With 11% of the population between the ages of 15 and 49 living with the virus, HIV/AIDS is a major public health concern in the nation. However, because nearly 73% of the population lives in rural areas, many with the disease are unable to seek treatment due to distance, inadequate physical structures, or treatment options. Building a single, well-equipped hospital alone with $6 million is out of the question. Therefore, instead we hope to reach those infected by the use of mobile clinics. The mobile clinic acts to reinforce the fixed clinic, providing temporary space for services while necessary changes at the facility are completed. Services offered by the mobile clinic include HIV care and treatment, point-of-care measurements of CD4 plus T lymphocyte count and hemoglobin, and tuberculosis diagnosis and care. Given that one mobile clinic costs about $100,000 a year, we would like to implement 10 mobile clinics, or one for each territory in the country. Approximately 120,000 of those infected desperately need treatment. With costs of treatment per patient per year being approximately $338, we find the upfront cost equals approximately $4 million. This includes the cost of equipment, van maintenance, staff costs, and the elements of treatment. A significant problem in the lack of treatment is also the lack of trained medical professionals. By implementing more mobile clinics, staff can be taught by the learn by doing method by fellow nurses or clinicians who have been selected to run the clinic. In doing so, staff will learn how to treat HIV/AIDS patients, laboratory skills, and patient documentation. The remaining funds will be therefore ultimately used to assist in the training of clinicians and also community involvement activities.
The Gender Inequality Index of Mozambique is higher in comparison to that of average low HDI countries. For instance, a higher percentage of the workforce consists of females rather than males. None of the other countries in the country's shared HDI category share this trend. There is also a higher percentage of female seats in the parliament. However, a significant problem that remains is the lack of secondary education. In comparison, very few females actually receive a secondary education. It is with the allocated funds of $4.5 million that we hope to spark or initiate change, thus improving girls' education in the nation. The most effective path towards solving the aforementioned issues is to target the roots of the problem. Improving educational opportunities is the main goal. Why is this important? Through this method, you can kill or maybe even two birds with one stone. The implementation of a better system of education is the first step in changing the traditional views of Mozambican society, such as the belief that women don't need as much education as men. Ultimately, by improving the education system, we aim to decrease gender disparity in Mozambique. Often because a family's income is low, parents cannot afford to send their children to school. Often a girl will not be able to attend school because her parents cannot afford the enrollment fees or simply the textbooks or stationery required to attend. Therefore, with $4.5 million, we hope to be able to provide modern textbooks, stationery, and other school supplies, and improve access to technology to girls and their families. Finally, we will pay the enrollment fee of as many girls as possible, or approximately $10 for every family who agrees to keep their girl in school.
While Mozambique has grown significantly since its independence, it still faces infrastructural problems. The $2.5 million would go toward paving roads to increase travel and trade from rural areas to major cities where a majority of their money can be made. Part of the money will also go toward enhancing sanitation in lower income areas to decrease the spread of disease and expand access to water, improving their quality of life. In keeping with our Foundation's mission statement, to formulate a proper development plan for Mozambique which will focus on bringing healthcare options to underserved rural areas, improving education in girls, and finally enhancing the infrastructure of the nation in order to ultimately further develop the nation, we currently believe that the amount of money we have put into this project will be enough to impact a small subset of the country's needs. But it is possible that the $13 million will not cover all expenses necessary to complete the grand undertaking of improving Mozambican quality of life. A risk factor would be corruption in the use of funds. For example, we cannot afford the Mozambican government not properly distributing the funds in which we have allocated and completing the various proposals we have come up with. This also means that we must have people also willing to build the various infrastructures, willing to distribute the materials necessary for education, and eager citizens willing to enforce or implement change.